Thank you, Leticia. Good morning, everyone. My name is Olina Gorodyski, and we have Leticia Reynoso here with us today. Welcome to your open enrollment meeting. And as you know, Creative Business Resources is your HR, payroll, benefits, and workers' compensation service provider. We are very excited to be meeting with you today. I'm the implementation specialist here at CBR, and Leticia Reynoso is our benefit manager. We would like to start the meeting before we move on to the open enrollment presentation with reviewing who your CBR support team is, and just remind you what every professional and specialist who is assigned to support Apricus Health MSO and ACOS are, and you will be provided with this information as well via email, just as a reminder to always contact your specialists, and we are committed to assisting you in the best way possible. We are here to help you in any way we can, and we will start with human resources team. So we have HR manager Johanna Lorcher, we have HR generalist Nancy Gayton, and HR administrator Elizabeth Miranda. Your main point of contact, if you would like to mark, is Nancy Gayton. Nancy provides general customer service. She can answer your HR questions. She will be setting up benefit deductions, helping you with benefit administration. If you have any questions or need for ID cards, she can help you with that. Nancy works with Johanna and Elizabeth to make sure that all of your HR questions and benefit questions are answered and you're always assisted. Elizabeth, our HR administrator, she mainly helps with new hire onboarding, but for the existing employees, Elizabeth helps with employment verification. So if at any time you need any employment verification for any purpose, please contact Elizabeth and she will assist you right away, because those are usually very time sensitive. And then we will move to your payroll specialist. Leticia, if you could please help me scroll down on this document. Thank you so much. You have Trisha Deemer. She's your HR specialist, payroll specialist, and she will be processing your payroll. She will be updating your tax withholdings. If at any time you would like to update your tax withholdings when you file your taxes in the end of the tax year, and you would like to make any changes at any time, please let Trisha know, and she will be happy to help you and update your withholdings at any time. If you have any changes to your direct deposit, to your paycheck, you can always let Trisha know. If you're adding or removing bank account, she will be processing everybody's W-2s, and Trisha can help if you are in need of a W-2 or if it didn't arrive in mail and you need it, she can always provide you with a copy. And our system specialist, Chris Etnier, she will be helping with any questions about time and attendance system, about onboarding system. And lastly, Travis Roberts, our loss control specialist, he will be helping with any questions about workers' compensation. If there's any questions about injury, he will be helping with claim management. He is he's an expert in the field, and he can always assist with all of those questions at any time. Do you have any questions to me in regard to your support team at CBR? Okay. If you ever have any changes, address changes, payroll changes, Trisha Deemer, payroll specialist, would be your best point of contact for that. You can just email Trisha and she can always assist you, and she can always guide you to ensure that you have the information and we have the information to process the change right away. At this time, I will turn it over to Leticia. She will go over all benefits available to you effective September 1st.
Thank you so much, Olina. Does anybody have any questions before we get started with the benefits presentation? Okay, great. So let's go ahead and get started. These are the items that we're going to be reviewing today: your medical benefits, dental, vision, and then your life and disability voluntary products that are available. Open enrollment begins today, so you may make changes, enroll yourself, dependents, etc. The benefits run until the end of this year. We will be approaching the team later this year as to the 1/1 benefits. Keep in mind, we do need all of the forms, enrollment forms, back in the office by Tuesday, September 1st. We need to process them as fast as possible so everybody has access to their benefits as soon as possible. So please get those back to us. I'm going to start with eligibility and qualified events. So everybody that works at Apricus is eligible for benefits, aside from yourself, your legal spouse. Domestic partner and children up to the age of 26 are also eligible for benefits. As you know, these benefits are effective September 1st and run until the end of the year, December 31st, 2020. So make sure that you choose wisely, because once you're locked into those benefits, you have to stay on them until the end of the year unless you experience a qualified event. And on the screen, you'll see some examples of qualified events: marriage, divorce, loss of coverage, birth of a child, adoption, etc. So there are quite a few qualified events. If you think you've experienced a qualified event that will allow you to make changes to your benefits, please contact your HR team here at CBR as soon as possible. You only have 31 days from the date of the event to notify us and be able to make changes if you choose to do so. We're going to go over 4 medical options that are being offered. The first 2 are with the Banner Network here locally, so they're Aetna JV Banner plans. Plan 1 is a $6,500 deductible for an individual, $13,000 for a family. And that's the same out-of-pocket maximum. So in a calendar year, or what's left of the calendar year, that is your worst case scenario as an individual or as a family. Now, if you meet your deductible, you've also met your out-of-pocket maximum, and at that point, you're into 100% coverage. Preventative care on this plan and all of the plans is covered at 100%. Under healthcare reform, we're entitled to 26 preventative exams depending on age and gender. So please schedule those as soon as you can once you have your medical ID cards. If you need to go see a physician for a sick visit, a walk-in clinic, it's going to be a $30 copay. Your specialist copay is going to be $65. You do not need a referral for specialists on any of the Aetna plans. Your urgent care and your emergency room are going to be subject to your deductible. What that means is you're going to pay the contracted negotiated rate when you need those services. You also have access to prescriptions at a copay. So you have 2 tiers for your generic, either a $3 copay or a $10 copay. Your preferred brand name medication is going to be a $35 copay. Your brand name is going to be 50% of retail, and specialty medication is 30% up to $300. Now you also have mail order available at 2 times the retail copay, so there's a little bit of savings there. Now, if you're at any expensive prescriptions, there are some, like GoodRx that you can go out to either on your phone or on the internet, type in the medication that you need, and hopefully you can find it for less money out near you. Type in your zip code and the medication you're taking, and it pulls up all the pharmacies that are closest to you. Also, the pharmacy within Costco is a standalone pharmacy. You do not need a membership to go in there and fill prescriptions. My understanding is their medications are pretty inexpensive there as well. Any questions on that plan? All right. The next plan is the JV Banner 3500. Now, this is a high deductible health plan that allows you to open a health savings account. So 2 different components to this type of plan. So this is a $3,500 high deductible health plan that is the individual deductible, and $7,000 is the family deductible. Should you meet your deductible in the rest of the plan year, you would go into coinsurance or cost share with Aetna. At that point, Aetna will pick up 90% of your costs and you're responsible for 10%, and that until you meet your out-of-pocket maximum. Again, that's your worst case scenario and what's left of the calendar year. If you meet that out-of-pocket maximum, then you will be into 100% coverage at that point for all doctor visits, services, and prescriptions. Everything is going to be subject to your deductible with the exception of your preventative care visits and maintenance medication and FDA-approved contraceptives. Those are all available before your deductible. Everything else, doctor visits, sick visits, specialist visits, emergency room, urgent care, non-preventative and non-FDA approved contraceptives are all going to be subject to your deductible before the copays. Once you meet that deductible, then you will have those copays for your prescriptions. And then again, for the rest of the services, you pay 10% if you meet that deductible, and Aetna at that point will pick up the rest. Now, this plan allows you to open a health savings account, and Apricus is being generous and applying HSA money to those that enroll in the JV Banner High Deductible Health Plan and put in some of their own money. So they are going to do a match up to $50. So very important there. That's very generous of the company to do that. So that allows you to put money in that account, use it for these medical services, dental, and vision as well. And we'll get to the health savings account in the next couple slides. This page talks about the Banner Network. This is a local network here in Arizona. You probably see them all over town. So you have access to hospitals, urgent care, walk-in clinics all over the valley. So keep that in mind if you're thinking about the Banner. We're going to go over the next two plans. This is a different network. This is called the Open Access Managed Choice Network. This is a national network. It is not just limited to the state of Arizona or the Banner network. This is all over the United States and does include Mayo Clinic and Phoenix Children's Hospital in the network. The Banner network does not. The Banner network includes Banner, Honor Health, University Medical Center, and Cardin's Children. The Open Access Managed Choice, which are these two plans here on the screen. Again, the Mayo Clinic and Phoenix Children are in this network. Okay, the first plan, or Plan 3 here on the screen, is a $2,500 individual deductible and $5,000 family deductible. If you meet that deductible for the rest of the plan year, you're going to go into that coinsurance or cost share with Aetna. They're going to pick up 80% of the cost. You're responsible for 20%, again, until you meet that maximum out of pocket. Excuse me, once you meet that maximum out of pocket, you will be into 100% coverage for the rest of the plan year. On this plan, if you need to go to see your regular doctor, walk-in clinic, sick visit, it's going to be a $35 copay, and the same applies to specialist. You are limited to 5 visits per calendar year for your regular doctor and specialist combined. If you exceed those visits, at that point, you will pay the contracted negotiated rate with those providers. The urgent care and emergency room on this plan are going to be subject to your deductible. Again, you will pay the contracted negotiated rate for those services. You have access to prescription. It's a little bit different on this one than the Banner plan. Again, you have 2 tiers for your generic, $3 or $10, $35 for your preferred brand name. Non-preferred brand name is going to be a $60 copay, and your specialty medication is 25% up to $250. And again, you can take advantage of that mail order at 2 times retail to save a little bit of money on those maintenance medications. You can get 90-day supply. Any questions on this plan? Okay. We're going to move forward to Plan 4 here. Again, Open Access Managed Choice with the National Network. This is a richer plan. It's got a $1,500 individual deductible and $3,000 family deductible. Then you have some cost share there with Aetna, so you're going to pick up 30% of the cost, and Aetna will pick up 70% until you meet that maximum out of pocket for the rest of the plan year. Again, both Plan 3 and 4 have preventative care covered at 100%, no out of pocket cost there. Now, if you should get your preventative exams and get a bill from your doctor, please make sure you reach out to us, and we'll be happy to contact Aetna or the provider. Sometimes it's just a coding issue. We're happy to assist with that. Office visits on this plan, again, your sick visits, walk-in clinics, it's going to be a $35 copay. Your specialist, a $50 copay. And again, you can self-refer to specialist. Urgent care is going to be a $75 copay. And your emergency room visit in or out of network is going to be a $250 copay. Keep in mind, if you go to an out of network hospital and it's a true emergency, you will not be balance billed. However, if it's not a true emergency, you will be subject to balance billing from that hospital. So keep that in mind when seeking emergency services. Again, same copays as Plan 3 for your prescriptions. Your generic medication, $3 or $10. Your preferred brand name, a $35 copay. Your non-preferred brand name, $60 copay. And your specialty medication, 25% up to $250. And then 2 times retail for your mail order 90-day supply. Any questions on the medical? All right, now we're going to talk about the health savings account that you can pair with the high deductible health plan. It's the Banner 3500. So you can, first of all, you have to enroll in that plan to be eligible for the HSA account. If you contribute up to $50 of your own money, Apricus will match that amount. So keep in mind those dollars that go into the health savings account is your money. You keep it. It rolls over year over year. There is no use it or lose it provision. You can use those dollars to pay for your medical expenses. You can also use it for dental and vision, any of those things. Amazon makes a lot of things convenient for us. One of the things that they make convenient for us is allowing us to shop on Amazon and use our HSA dollars. So you can go on there and you can search for HSA qualified items and you'll see a list there. A couple of qualifiers here. Number one, please enroll in the Banner 3500. Number two, you cannot be covered under somebody else's health plan that is not a high deductible health plan. So if you're going to enroll in this plan, but you are covered with a spouse or a domestic partner or under a parent's plan, and it's not a high deductible health plan, you cannot enroll in the HSA here. If you're enrolled with a spouse or on another plan that is a high deductible health plan, then you may enroll the high deductible health plan and open your HSA account. Also, you cannot be enrolled in Medicare. You may be Medicare eligible, but as long as you're not enrolled in Medicare, you may still open your health savings account. And then lastly, you cannot be claimed as somebody's dependent on their tax returns. Those are things that would exclude you from opening a health savings account. Couple things here, notes. So for the 2020 plan year, the IRS maximum HSA dollars that you may set aside, again, these are pre-tax dollars, is $3,550 for an individual. And for a family, it's $7,100. Now, under IRS rules, a family is considered 1+. So it could be 1+ a child or a spouse or an entire family. And if both you and a spouse or domestic partner are enrolled in a high deductible health plan with an HSA, combined, you cannot exceed the $7,100. If you happen to go over the $7,100, keep in mind that that will be taxed at 40%. And if you're 55+, you can add an additional $1,000 to that annual maximum. In 2021, there will be new HSA maximums that we will communicate later this year. Any questions on the HSA? We provided a benefit guide that gives you information how to open your HSA account. If you have any questions in regards to how to do that, please reach out to us and we'll be happy to help. Next, we're going to go over the flexible spending account, not to be confused with the HSA. This is an FSA, so two different things. They work similarly as they're both deducted from your paycheck pre-tax, so helping in lowering your taxable income. Very important there. The HSA is your money. You get to keep it, whether you stay with the company, change to a different plan, it doesn't matter. That is your money, stays with you. And then the bank that we partner with allows you to, once you reach a threshold of $1,000, invest some of those dollars. Any interest earned is also yours and it is not taxable. So that's an HSA. This is going to be the FSA or flexible spending account. So this compares with all of the other plans that are not high deductible health plans. If there's a copay involved before deductible, you can enroll in the flexible spending account. So the flexible spending account for us carries a maximum of $2,500 for a plan year. If you're going to be enrolling in the flexible spending account, just keep in mind how many paychecks are left for the rest of the year, because it will be deducted per paycheck if you elect the full amount. Again, the maximum is $2,500, and it does have a $500 rollover provision. What that means is on December 31st, 2020, if you have $500 in that flexible spending account, or FSA, you can carry it over to the 2021 plan year. Anything in excess of $500 will be forfeited. So keep that in mind if you're going to enroll in this, how many dollars you can set aside. And again, you can use these dollars for copays for prescriptions, doctor visits, dental, or vision, a lot of things. And again, there is an FSA store. It's called fsastore.com. And then of course, Amazon also makes it easy for us too, because they've also created FSA eligible items on their site. So that's the healthcare FSA. You're also eligible or have the ability to enroll in the dependent care FSA. Again, pre-tax dollars that you set aside to pay for daycare or elderly care. And there is a calendar maximum of $5,000. So this goes into an account. You can use those dollars to pay yourself or pay your provider. Any questions on the flexible spending account? All right, we're going to go over the dental plans. Now, you do have 4 dental plans to choose from, so quite a few options here, and I'll go over them. And the benefit summaries were included as well, because that'll give you, the benefit summaries will give you more details to coverage, limitations, and exclusions. So the first plan here, the base plan, is a $1,500 annual maximum. So that is how much each person that's enrolled in this plan has to use towards their dental services. So every if you're enrolled as an employer, your spouse, and your children, each person has $1,500 to use towards their dental services for the rest of the plan year. If for preventive, so your cleanings twice a year are covered at 100% and are not subject to a deductible or out-of-pocket expenses. Now, also, if you have any type of like diabetes, coronary heart disease, anything, or pregnant, you get a 3rd cleaning at no cost. And Delta Dental does not mandate the cleanings be every 6 months. It could be every other month. You know, there's not a whole lot of time left for the end of the year. So if you want to get those 2 cleanings in before the end of the year, schedule those. Again, that's your preventative care. Basic services are going to be subject to your deductible. So your basic services on this plan are going to be cavities, simple extractions, and emergency services. That's what's going to be covered under basic on this plan. And at that time, you will be subject to a $50 deductible as an individual or $150 as a family. And then you will pay 20% of the cost, and Delta Dental will pay 80% of the cost, again, deducting from the annual $1,500 maximum. Major services, endodontics, periodontics, root canals, things of that nature, it's a 50-50 cost share. If you have not paid the deductible and you seek those major services, at that point you will be subject to that deductible. This plan also carries a $1,000 orthodontia benefit for children, and that again is a lifetime benefit. Now, if you notice on all of these plans that we're going to go over, the in and out of network pays exactly the same. The biggest difference with the in and out of network, the out of network providers may balance bill. So Aetna will still cover a portion, but that dentist has not signed a contract and has not agreed to a set amount, so they can balance bill you for any differences. So seek in-network providers whenever possible. We're going to go over the buy-up plan number 1. So it looks very similar to plan 1. You have or the base plan. So it's again a $1,500 annual maximum. Your preventative services covered at 100%. You're going to be subject to that deductible, same as the other plan for basic services or major services. Now, under basic services on this plan, some of those items that were on the base plan now shift to basic services. Endodontics, periodontics, now they move up to basic services. So a lot more services are going to be covered there. And then major services, again, a 50-50 cost share with you and Delta Dental. And then the orthodontia benefit goes up to $1,500, again, for children. And that is a lifetime benefit. Same thing applies for the out-of-network benefit. Very similar plans, just different. Just the coverages or the covered items moved from major to basic, and then you have $500 more for the orthodontia. And then we have the PPO buy-up plan too. This one has a $2,000 annual maximum for each person enrolled. Preventative services, again, covered at 100%. The basic services now move to 90% versus 80% on the other plans. And then a lot more items that were in the major services now shift up to basic services. So you get a lot more services under that basic covered at 90%, and then you're going to pick up 10%. Similar to the other two plans, you will be subject to that one-time deductible of $50 for an individual or $150 as a family, and you only pay that once a year. Your major services now go up to 60%, which means you only pay 40%, and Delta Dental picks up 60%. Now, implants are covered on the plan, and they have maximums. So take a look at those summaries that were sent out, so you can see what those maximums, limitations, and exclusions are. Now, on this plan, the orthodontia goes up to $2,000, and now it is for adult and children. So it's same benefit for adult and children, and it is a lifetime benefit for that. You do have one more dental plan. It's called a DHMO plan, and this is Delta Care USA, still under Delta Dental. Similarly to a medical HMO plan, you have to pick a provider. If you and a spouse and children are enrolled in the DHMO, you may all have a different provider. You do have to elect a provider. If you don't, then Delta will assign one to you based on your home zip code. You can change that provider at any time during the year. As long as you do it before the 20th of each month, that new provider will be available for the next month. But it is very important that you pick a provider. That provider will schedule and refer you out if you need to go to specialists. On this plan, your preventative care is going to be covered at 100%, and then all other items are a fee schedule. There is no annual maximum on this plan, and there is no annual deductible. Everything is going to be on a fee schedule. I will go over that shortly. Any questions so far on the dental? Okay, so what you see here is the actual page from the fee schedule, and it's the diagnostic page. So as you can see, some of the evaluations, all the exams, those are going to be at no cost. There's a $5 fee there for re-evaluation. So if you have to go back a second time, it's a $5 copay. Everything else, periodontics, endodontics, root canals, braces, teeth bleaching, extra cleanings, all that is going to be at a scheduled benefit, and that was also included in what was sent out to you. Now, if you enroll in this plan, you'll get a letter with the provider listed and instructions on how to change the provider if you need to do so. In the event that after you register, you go and find a provider and you're having an issue with finding a provider, please reach out to us so we can assist. There are a lot of providers nationally that are on the DHMO network and the PPO network. The DHMO network here in Arizona is pretty big. They have about 90% of the market share for DHMO providers, and hopefully you can find one. Now, again, if you can't find one based on your home zip code, let us know and we'll definitely assist with that. Some resources available through Delta Dental. Of course, they have a phone app like everybody else. So, if you're tech savvy, tech guru, and everything is done by your telephone, download the app. You'll see your ID card on there, find providers, see how much you've spent of your annual maximum. And it's very helpful to have those there. I recommend that everybody go onto the deltadentalaz.com website and create a login so you have access to everything that's available to you. Next, we're going to go over the vision plan. It is also through Delta Dental using the iMed network. And we're going to go over the benefits. So your exams that you can get every 12 months is a $10 copay. So it is 12 months to the day, like most insurance providers. If you had an exam, you were covered before, and it's going to be new coverage, then you're not subject to those limitations. But when you enroll this time around and next year you have to go back, you do have to wait 12 months to the day. For your frames, should you choose glasses, you get a $120 allowance and then a 20% discount, anything over $120. And your lenses, these are going to be the plastic lenses, single vision, bifocal, or trifocal, are going to be a $10 copay. And then contact lenses, you have an $80 allowance and then 15% off over $80. And then medically necessary contact lenses are going to be covered in full. And you can have, you have the benefits available, all benefits available every 12 months. IMED does treat the contact lenses and the lenses for your glasses exactly the same, so you can only have one per year. So if you choose to get full glasses, your frames and your glasses, and you still want contact lenses, you get a 40% discount on those contact lenses, so you can technically have both during the year. And the network for IMED is called Insight. So when you're searching for a provider, you can go on the website. As long as you choose Insight, put in your zip code, you'll get providers that are listed on the state of Arizona or nationally. Okay, next we're going to go over the voluntary life benefits. So the benefits are provided today from Unum. So if you're newly eligible for the benefits under Apricus, you have the ability to enroll up to 5 times your annual earnings, with $200,000 of it being guarantee issue. What that means is no medical underwriting, no physical exams, none of that. You will not be subject to any of that. Again, if you enroll this time around. If next year we come back and we offer the life benefit again and you didn't enroll the first time, then you will be subject to evidence of insurability for any amount. Again, up to 5 times annual income. The maximum is $500,000, but up to $200,000 is guarantee issue. And then going back. And then for the spouse, $25,000 is going to be guarantee issue. And for dependents, it's $10,000 guarantee issue. And it is a large group benefit, so the rates are very reasonable. We sent that information out as well. If you have any questions or need help calculating what the cost would be, please reach out to us and we'll be happy to assist. Short-term and long-term disability are also available on a voluntary basis. So both the short-term and long-term disability programs cover up to 60% of your pre-disability earnings. For the short-term disability, the weekly benefit is 60% up to $1,000. The benefits begin after the 14th day of accident, illness, or hospitalization, and the benefit duration is up to 11 weeks. For the long-term disability, again, 60% of your pre-disability earnings, up to $7,500 per month. The elimination period here is 90 days. So if you enroll in both the short-term and the long-term and you're disabled, once the short-term terminates, it should dovetail right into the long-term disability. There should be no gap there. The long-term disability benefit does last until age 65 or normal Social Security retirement age. Now, both plans do have a pre-existing limitation, which is called a 312. So if you were diagnosed, saw a provider, took medication for a condition, which in there you went out on disability for, that would not be a compensable disability. It would be disallowed for 12 months. If it's something completely different, then that would be fine. Any questions on disability? Okay. Some of the AFLAC products that are available, we do work directly with AFLAC. We have a representative that we work with, a team. And some of the items that you see on the screen here, we also sent in a information sheet that we would like to have back if you want to meet with Jose or have a telephone call with Jose. Everything's done virtually these days or telephonically. Some of the plans that are available are the cancer coverage, accident coverage, hospital choice, critical illness, and there are some riders that you can add on top. So these are very customized indemnity plans. So these pay you. They don't pay the providers. They don't do coordination of benefits with the insurance company. None of that happens. It goes directly to you, the policy owner. So if you're a weekend warrior and you have an accident out on your ATV or you're hiking and you fall and you roll an ankle and you see a provider, you can submit that claim as an accident claim to AFLAC and they will send you some money. Same thing if you do any virtual visits with your doctors for accidents or sick visits, hospital visits. If you buy the hospital plan, those are compensable. They also have a wellness benefit. So if you enroll in any of the Aflac plans and you go to your provider and get your teeth cleaned, vision exam, or your wellness exam through your medical provider, and you submit a claim through Aflac, they will also pay you. I believe it's up to $60 and it's one time a year. So really good benefits there to take advantage of. Some other benefits that are available to you, these are all voluntary benefits. The Legal Shield and ID Shield. So Legal Shield provides legal assistance discounts through a group of attorneys. ID Shield protects you against identity theft. So if you've ever been a victim of identity theft, you know it's very cumbersome and the responsibility and all the work falls upon us, the victim. So it's a really good thing to have in your back pocket. Sorry. And then pet healthcare. So we partner with United Pet Care to provide coverage to your pets. They cover any type of pet except for fish. I asked. I'm not sure why, but any kind of pet, any breed. There are no pre-existing limitations. So if you have a pet now that's ill and you need to take them to the vet, you've been holding off, you can enroll and take them in for some really good discounts. It's at a reasonable cost, and then I pay a $40 copay when I go to the veterinarian to take my dog, and then she gets all of her exams, also her allergy medication and the shots that she needs for that $40 copay. So it's a pretty good discount. So if you need more information, we provided a flyer. You can also go to the website. We have the website on the flyer or on this presentation as well. Just a couple of reminders here. Everyone must complete a waiver or an enrollment form by September 1st. There are no exceptions to that. That is the only form we need back. That's it. No other forms. I know you received a lot of information, but the only form we need is that enrollment form, and I'll bring it up here shortly just to point out which one it is. All other forms and coverages are going to be 100% optional. If you're going to enroll in that high deductible health plan with the HSA, you do need to open your health savings account as soon as possible. That's the only way we're going to have an account to put in the money that you're going to elect, and then the Apricus match as well. It's very important to open that account as well, because if you sometime in September have to use your services and your account is not open, you cannot use any of those dollars to pay for services. So it has to be, even if it's open with $0 and then you have a claim hit in September, you can put money in there to pay for those services. So it's very important to do that. Any questions? Okay. Let me bring up the form.
Excuse me.
Yes.
I do have a question.
Okay.
So I work for ACOS,
Okay.
and I just started there, and my benefits are supposed to start September the 1st. Do I have to redo this form now?
Olina, do you want to take that question?
Yes, this will be the new forms.
Okay, so even though my service starts on the 1st of September, I still have to go through this enrollment again.
Yes.
Okay.
These are, everyone is enrolling in these new benefits effective September 1st, and any benefits that were prior to September 1st would no longer be effective and active.
Okay, perfect. Thank you.
Of course, you're welcome.
Thank you so much, Olina. So this is the form that needs to be completed by everyone, whether you're enrolling or waiving. It is, a form you can go on. Once you have it up on your screen, you can fill it out and return it to us. Again, we made in the link, it's Nancy Gaytan. We provided her email address that it could go directly to her. Again, by Tuesday, so we can rush enroll everybody. So make sure on section C, if you're going to enroll in the high deductible health plan, which is going to be plan number 2, that you tell us how much of your money that you want to go into this HSA account. If you put a 0 there, then there's going to be no money coming out of your account going into the HSA. You may not be eligible for the match. Dental options are here. Vision, against big buttons for your waive if you're waiving any of your coverages. And then I'm going to back up just a minute to section B for your dependents. Make sure you give us all of the information for your dependents, please. Name, date of birth, gender, social security number, because we do need to collect that data. Towards the bottom of this page is section F, where you tell us why you're going to be waiving. We again need to collect that data. And then we just need a couple of signatures as well. Does anybody have any questions on what to return, deadline, or anything we've gone over today? Okay, I just want to make one announcement. I know that 401k information will be available sometime in October. Sky Parker will set up meetings to go over that. And also, I just want to let everyone know that your telemedicine provider will be forthcoming. So look for communication in regards to that. All right, thank you, everybody.
All these forms need to be filled out by the 2nd?
Just this is the only one that's mandatory, the one that's on the screen now, that at the very top it says Apricus Health Benefit Enrollment Change Form, form number
Okay.
1. That's the only one that's necessary. The rest of the forms are voluntary coverages. If you would like to enroll in any of the other coverages, fill those out. If you do not, we don't need it.
Okay. And this is for ACOS employees as well?
Correct.
Okay. Thank you.
You're welcome. Any other questions? All right. Thank you, everybody, for your time, and have a good rest of your day.
Thank you, everyone.